Hi, I'm Dr. Rick Duplantis, and you're watching It's Your Health. Tonight's show is on a neurological condition called Bell's palsy. Bell's palsy is a form of temporary facial paralysis resulting from damage or trauma to the facial nerves. The facial nerve, also called the seventh cranial nerve, travels through a narrow bony canal called the fallopian canal in the skull. And this is beneath the ear, and it goes to the muscles on each side of the face. For most of its journey, the facial nerve is encased in this bony shell, this fallopian canal. Each facial nerve directs the muscle on one side of the face, including those that control eye blinking and closing, facial expression, such as smiling and frowning. Additionally, the facial nerve carries impulses to the lacrimal or tear glands of the eyes and the saliva glands in the mouth, and also to the muscles of the small bones of the middle ear called the stapes. Now, the facial nerve also transmits taste sensations from the tongue. So when Bell's palsy, the condition, occurs, the function of the facial nerve is disrupted completely, causing an interruption in the message from the brain, sending it to the facial muscles. This interruption results in facial weakness or paralysis on the affected side. Bell's palsy is named for Sir Charles Bell, a 19th century Scottish surgeon who was the first to describe the condition. The disorder, in which is not related to stroke, is the most common cause of facial paralysis, actually. Generally, Bell's palsy affects only one of the paired facial nerves and on one side of the face. However, in rare cases, it can affect both sides. What are the symptoms of Bell's palsy? Well, because of the facial nerve, and it has so many functions, and it is so complex, damage to the facial nerve or its disruption in its function can lead to multiple problems. Now, the symptoms of Bell's palsy can vary from a person to person, and each is individualized. And it can range in severity from a mild weakness to a total paralysis of the muscles of facial expression. Now, these symptoms may include such as twitching, weakness, or paralysis on one or rarely both sides of the face. Other symptoms may include drooping of the eyelid and drooping of the corner of the mouth on the affected side, dryness of the eye or dryness of the mouth, also impairment of taste, and excessive tearing in one of the eyes. Most often, these symptoms, which usually begin suddenly and then they reach their peak within 48 hours, they lead to significant facial distortion. That's the downside of this condition with facial distortion. Other symptoms may include pain or discomfort, which occurs around the jaw and behind the ear, like something is pinching the back of the ear. There's also ringing in one or both ears when you get this condition. Bell's palsy can bring on some very bad intractable headaches, loss of taste, and a hypersensitivity to sound on the affected side, so that any sounds made are magnified. Bell's palsy can also impair speech. You can get dizziness, and you can have difficulty eating or drinking. Can you imagine when the muscles of the facial expression go out and also the saliva production is affected? So, I guess the next question is, what's this cause of this awful condition called Bell's palsy? Well, they don't really know. That's the bottom line. There are a lot of theories of what causes Bell's palsy. Now, the Bell's palsy occurs when the nerve that controls the facial muscle is swollen, becomes inflamed, and compressed, resulting in facial weakness or paralysis. Now, what happens is this: when this viral situation attacks the nerve, causes the inflammation of the nerve in the fallopian canal, there's nowhere for the nerve to go or to expand. And so when it reaches its maximum expansion and it continues to be increased in size, it starts to be compressed. And this is a compression It causes this nerve to actually die and undergo what we call wallering degeneration in the nerve. This results in facial weakness or paralysis. So exactly what causes it, like I said, we don't know. Most scientists believe that a viral infection, such as viral meningitis or the common cold sore virus, herpes simplex, causes this disorder. And as such, they address it because it's an inflammatory process, and they think, did not know definitely, that it's caused by herpes simplex. They give the patient prednisone, is the mainstay of treatment, and they give also antiviral medications like Valtrex. They believe that the facial nerve swells and becomes inflamed in a reaction to this viral infection. Now, these virus, the herpes simplex virus, lies dormant in the dorsal horn of these nerve cells. When this inflammation occurs in the nerve, crossing through the fallopian canal, going to the muscles of facial expression, this brings about pressure within this canal, this fallopian canal, and this leads to ischemia, which we call a restriction of blood and oxygen to the actual nerve cell. Thus, when you get destruction of a nerve, you get dysfunction. In some mild cases where recovery is rapid, there's damage only to the myelin sheath, that sheath of fat that covers the nerve and aids in conduction. But the myelin sheath is this fatty covering. It acts as an insulator on the nerve fibers in the brain. Now, the disorder has also been associated with influenza or flu-like illnesses, headaches, chronic middle ear infections, even high blood pressure, diabetes, sarcoidosis, tumors, Lyme disease, and trauma such as skull fractures or skull injury. Now, of course, we want to ask the question, who will get this condition? Who gets Bell's palsy each year? Well, approximately 40,000 Americans each year suffer from this dreaded condition called Bell's palsy. It affects men and women equally and can occur at any age, but it is less common before the age of 15 or after the age of 60. Bell's palsy disproportionately attacks people who have diabetes or upper respiratory ailments such as the flu or a cold. Now, how would you diagnose Bell's palsy? Because it kind of looks like a stroke with facial paralysis. Diagnosis of this condition is made based on clinical presentation, including the distorted facial appearance and the inability to move the muscles on the affected side of the face, and by ruling out other possible causes of facial paralysis, specifically stroke. Now, there's no specific lab test to confirm a diagnosis of this disorder. Generally, it's a clinical call. The physician will examine the individual for the upper and lower facial weakness. In most cases, this weakness is limited to one side of the face, occasionally isolated to the forehead, eyelid, or mouth. A test called the electromyography, EMG, can confirm the presence of nerve damage and determine the severity and the extent of the nerve involvement in Bell's palsy. Blood tests can sometimes be helpful in diagnosing other concurrent problems such as diabetes and certain infections. The MRI, the magnetic resonance imaging, or the CT, computed tomography scan, can eliminate other structural causes of pressure on the facial nerve. And now we know what more or less causes it, how it comes on. How do we treat this condition? Well, Bell's palsy affects each individual differently, as I said early on. Some cases can be very mild and don't require any treatment at all, and they're self-resolving, and the symptoms subside within 2 weeks. For others, the treatment may include medications and other therapeutic options. If an obvious source is found to cause Bell's palsy, such as infected, the treatment can be directed toward this and can be beneficial. Now, recent studies have shown that steroids, such as the steroid prednisone, used to reduce inflammation and swelling, are effective in treating Bell's palsy, thereby decreasing the inflammatory process and the shrinking of the nerve in the fallopian canal. This is effective in treating Bell's palsy, and the drug is used commonly for the treatment. Other drugs, as I mentioned, acyclovir, which is to address the herpes simplex virus, thought to be caused by a cause of Bell's palsy, is also used in treatment of these people to fight this viral herpes infections. It may also have some benefit in shortening the course of the disease, as does prednisone as well. The earlier you can address Bell's palsy with a proper medication, especially prednisone, the quicker of the resolution of these symptoms and these facial distortions that you will see in the patient and that people will experience. Okay, we'll take a short break at this time, and we'll be right back after this message. Hi, I'm Dr. Rick Duplantis with a follow-up and continuation on vitamin E. You know, heart disease is the #1 killer in the United States, and the evidence supporting vitamin E's efficacy in preventing and reversing heart disease is overwhelming. 2 landmark studies published in the New England Journal of Medicine followed a total of 125,000 men and women healthcare professionals for a total of 839,000 persons study years. It was found that those who supplement with at least 100 IUs of vitamin E daily reduced their risk of heart disease by 59 to 66%. The studies were adjusted for lifestyle differences such as smoking, physical activity, dietary fiber intake, and even aspirin use. This was done in order to determine after our short break, and tonight, if you're joining us late, I'm Dr. Rick Duplantis, watching It's Your Health. Topic of our show tonight is Bell's palsy, and I'll pick up where I left off. You know, we talked about Bell's palsy being an inflammation of the nerve, swelling of the facial nerve, the 7th cranial nerve in the fallopian canal, this bony canal that goes out to the muscles of facial expression. The nerve begins to swell beyond its ability to expand in this narrow and limited canal, thus starving off oxygen and blood supply to the nerve, resulting in a degeneration of that nerve, death of the nerve, a process we call wallering degeneration in medicine. And there are many drugs, you know, two basic drugs. The first being prednisone, used aggressively to treat this condition, can shorten the length of time and resolve these distorted facial conditions due to the shutting down of the facial nerve and affecting muscles of facial expression. The second drug we talked about addresses the virus that they think, don't really know, but they give it. Acyclovir is given, usually prescribed for the patient with Bell's palsy, used to fight this viral herpes infection that's believed to be a cause of the Bell's palsy condition. It shortens the course of the disease. Now, analgesics such as aspirin, acetaminophen, or ibuprofen, may relieve the pain, because with Bell's palsy, earlier on I mentioned headaches, and these headaches are very bad headaches that accompany Bell's palsy. Because of a possible drug interaction, individuals taking prescription medication should always talk to their doctors before taking any over-the-counter drugs. Another important factor is treatment is eye protection. With Bell's palsy, it can interrupt the eyelid's natural blinking ability. This will cause eyes to dry out, leaving the eye exposed to irritation and drying. Therefore, keeping the eyes moist and protecting the eyes from debris and injury, especially at night, is important. They usually use natural tears in the treatment and addressing this to properly lubricate the eyes with eye drops, the artificial tears, or eye ointment or gels, and eye patches are also effective, especially at nighttime. Physical therapy is used sometimes to stimulate the facial nerve to help maintain muscle tone and may be beneficial to some individuals. Facial massage and exercise may help prevent permanent contractures, shrinking or shortening of the muscles of the face, of the paralyzed muscles before recovery takes place. So this is something that can be put in place: muscle stimulation and also massaging the face muscles on the affected side. We call it the ipsilateral side, the side of involvement. Most heat applied to the affected side of the face can help reduce pain. Other therapies that may be useful to some individuals include relaxation techniques, acupuncture, electrostimulation, biofeedback training, and vitamin therapy, including the B complex, specifically B12, B6, and zinc, which may help to restore this natural and nerve function. It takes a long time once a nerve is damaged for it to regenerate. It regenerates very slowly. In general, decompression surgery for Bell's palsy to relieve pressure on the nerve is controversial and is seldom recommended. But I have seen a case where facial nerve decompression was done to relieve the intractable headaches that are associated with Bell's palsy. I guess the time period may last up to several years, and then eventually the fallopian canal will become shortened again, narrowed again, you might say, over a period of time. So you might get a window of maybe 8-9 years of total relief from Bell's palsy. The facial muscle regeneration or restoration, I might add, after dysfunction of a bout of Bell's palsy, if it's been long-standing, the prednisone failing to be effective, skull-based surgeons may go in and do this surgical procedure to decompress the facial nerve and the fallopian canal by boring out this canal, from tracing the facial nerve from the base of the brain out to the muscles of facial expression. On rare occasions, cosmetic or reconstructive surgery may be needed to reduce some of the deformities that occur, and it can help correct this damage, because a lot of times with Bell's palsy you get eyelids that will not fully close, or you get a crooked smile. And what's the prognosis of this condition? Well, not very good. The prognosis for individuals with Bell's palsy is generally, actually, varies from one person to the next. The extent of nerve damage determines the extent of recovery. Now, I guess the prognosis in individuals with Bell's palsy is very good if you aggressively address it as soon as possible. Like with any medical condition, if caught early, the condition can be addressed aggressively and more successfully than if it goes on over a long period of time and damage ensues. Now, the extent of nerve damage determines, of course, the extent of recovery. Improvement is gradual, and recovery times may vary with Bell's palsy. With or without treatment, most individuals begin to get better within about 2 weeks after the initial onset of symptoms, and most recovery is completely, and they return to normal function within about 3 to 6 months. All signs are completely gone. For some, however, the symptoms may last longer, unfortunately. In a few cases, the symptoms may never completely disappear. In these cases, the disorder may recur either on the same or the opposite side. It can occur 1, 2, 3, or 4 times on the same side of the face as it occurred previously. Within the federal government, the National Institute of Neurological Disorders and Stroke, part of the National Institute of Health, is responsible for supporting and conducting research on brain and nervous system disorders, including Bell's palsy. A great deal of research is ongoing in this area to try to find an actual cure and find an actual specific cause for this, because the fact that Bell's palsy occurs with individuals with the herpes simplex virus theory. It's not really confirmed if this actually is a culprit, but it's treated nonetheless when a person develops Bell's palsy. Knowledge gained from research helps scientists find the definitive cause for this condition and leads to discovery of new effective treatments for the disorder. Ongoing developing programs for damaged nerves and try to restore these nerves to full use and strength to the injured areas, and finding ways to prevent nerve damage and injuries from occurring in general. Now, I want to say that Bell's palsy is also termed idiopathic facial paralysis. It is the most common cause of one-sided or unilateral facial paralysis, and it's the most common cause of facial paralysis worldwide. It's one of the most common neurological disorders of the cranial nerves, actually. In the great majority of cases, Bell's palsy gradually resolves over time, and its cause, like I say, essentially unknown. New Bell's palsy guidelines are issued by the American Academy of Otolaryngology, the Head and Neck Surgery Foundation, and the American Academy of Otolaryngology. Head and Neck Surgery Foundation has issued updated guidelines for the diagnosis and the management of Bell's palsy that recommended the use of corticosteroids within 72 hours after the onset of symptoms in patients 16 years of age and older. Also, antiviral agents, acyclovir, valcyclovir, may be considered if a viral etiology is suspected, such as a viral cause, but only in combination with corticosteroids. Additional recommendations include the following, such as patients with acute onset of one-sided facial paralysis should be assessed to exclude other possible identifiable causes, such as herpes zoster, Lyme's disease, and sarcoidosis. Diagnostic imaging and routine lab tests are not recommended for patients with new onset disease. Electrodiagnostic testing is not recommended in patients with incomplete facial paralysis. However, it may be offered to those patients with complete facial paralysis. If there is impaired eye closure, the appropriate eye protection should be implemented, and referral to a facial nerve specialist should occur in cases of new or worsening neurological symptoms, developing ocular symptoms, or incomplete facial recovery after 3 months. These are the guidelines. The signs and symptoms of this condition, as I mentioned, include the following: acute onset unilateral upper and lower facial paralysis over a 48-hour period. Posterior auricular pain behind the ear on the prescribed side, or the ipsilateral side. Decreased hearing, hyperacusis, where your hearing becomes magnified on one side, taste disturbances, otalgia, weakness of the facial muscles, poor eyelid closure, and an ache of the ear on the affected side, such as in the mastoid region behind the ear, tingling or numbness in the cheek and the mouth, and ocular pain, blurred vision, and even flattening of the forehead or nasolabial fold on the side affected by Bell's palsy. Now, when a patient with Bell's palsy raises eyebrows, the palsy on the affected side of the forehead remains flat. That's how you can distinguish between Bell's palsy and stroke by this particular test, because facial paralysis is seen in stroke. Now, when a patient smiles, the face becomes distorted, and there's a lateralization to one side opposite of the palsy. The diagnosis, like I said, examination for Bell's palsy includes the otologic examination, pneumatic otoscopy, and tuning fork examination, particularly the evidence of acute or chronic otitis media is occurring. Ocular exam, patient may often be unable to completely close the eye on the affected side, and then you want to do an oral exam to taste, and salivation may also be affected by damage to the 7th cranial nerve. The neurological workup is all cranial nerves to be tested, sensory and motor testing, and cerebellar testing as well. Now, there's a grading system for Bell's palsy. It's by House and Beckman. Categorize Bell's palsy on a scale of 1 to 4. Okay, grade 1 would be normal facial function. Grade 2 would be mild dysfunction. Grade 3 would be moderate dysfunction. Grade 4, moderately severe dysfunction. And grade 5 would be severe dysfunction. And a grade 6 on this scale, total paralysis. Testing, although there's no specific diagnostic test for Bell's palsy, the following may be useful to identify or exclude other disorders. These tests include, the rapid plasma reagent VDRL test, or fluorescent treponema antibody absorption test, HIV screening by enzyme-linked immunoabsorbent assay, or the Western blot test. CBC can be done, the erythrocyte sedimentation rate, thyroid function can be checked, your glucose, cerebrospinal fluid, blood glucose level, because the Bell's palsy can be associated with diabetes. You might want to check the hemoglobin A1C as a result of that. And other tests such as a Schimmer blotting test, a nerve excitability test, CT or MRI. Now, the management and goals of treatment of Bell's palsy is to improve the seventh cranial nerve function, to reduce the neuronal damage, and to prevent complication from corneal exposure. Now, the treatment includes the corticosteroid therapy, aggressively started initially as soon as possible within 72 hours, with the use of prednisone, the antiviral agents. Also, eye care, the topical ocular lubrication is usually sufficient in most cases to prevent corneal drying, abrasion, and or ulcers. Like I said, there are surgical options: facial nerve decompression, subocularis oculi fat lift, implantable devices placed into the eyelid, and transposition of the temporalis muscle, facial nerve grafting, etc. These are very radical procedures not normally done in the treatment of Bell's palsy. I'm Dr. Rick Duplantis. I hope that you have gotten some insight of what causes Bell's palsy, how Bell's palsy presents, its symptomatology. When you notice something like this, please go to your doctor at once. You're not going to know whether it's Bell's palsy or stroke affecting, because when you're going to get facial nerve paralysis and you start having these wild symptoms occur, and you look in the mirror and you look like you think you've had a stroke, you want to see your physician at once. Because the earlier the treatment of this condition, the better results you're going to have in the resolution of symptoms, discomfort, and long-term effect of Bell's palsy. Dr. Rick Duplantis, I hope you have a very pleasant evening, and good night.